All right, welcome. Today we'll talk about parosmia, and this has been something that is really annoying, and lots of people are having this. And let's keep talking about this today about all the changes in smell that everyone is having. So let's get right into it. So we had comments, lots of them on the videos that we had before, and those comments always talk about the changes in smell. So never said that I got COVID in January, 2 weeks, my smell came back, taste came back, and then 4 weeks later, then I hit parosmia. Everything feels weird, smells weird, and then it feels like the things were plugged in the wrong socket, and potato smell like starch, and everything is different. Adikam said that I have had distorted smell for a half a year now, and I got COVID last March. It is really annoying to hear this. Yes, this is a very common issue, and we have been seeing this for very long time. Since we started dealing with COVID-19 in my post-COVID-19 neurology clinic, we had lots of complication or the long hauler symptoms after COVID-19, and those complications have been going on for a long time. So today we'll have all the tips and tools and treatment for parosmia so that you can get your distorted smell and taste hopefully back and treatment. All right, let's get right into it. So we'll talk about how this parosmia happens. So parosmia happens because of this. So what happened is that when you get COVID-19, there is inflammation in the brain and nerves that will change and damage the nerves, and then especially the olfactory nerves. The nerves are responsible for smelling and tasting, and that will damage them. Then what happened is that there is demyelination, which is like the covering of the nerves will get distorted and affected. So what happened is that when you get the nerves back to regenerate, then sometimes it will cross-link and go into the different plugs, like others said. So what happened is that you get your sense of smell distorted because the signal is supposed to go to the brain, to the right center. For example, if you smell coffee, it should go to the coffee center, not to the rotten food center. And what happened is that it goes to the different location, and that can distort the smell and distort what you are feeling. So there are lots of good news here. Even though I totally understand that this is very, very disturbing to have, and it is very stressing and mind affecting people because of this changes in smell. But the good news is that, first, it is a sign of recovery. When you lose your smell completely, then it will be coming back slowly. And when the smell comes back, then the smell will come back, and then will start to sometimes plug into the wrong sockets, and then you will have the parosmia. So it can be a good sign of recovery. That means you are on the right track and get better. The second thing is that parosmia is not harmful to you. So you should know that parosmia is not harmful. That means it will not change your brain. It's not a sign of something wrong going in your brain. It is just a physiological process after the nerves regenerated in the wrong way. So the thing is that parosmia is different for every person. We will see lots of videos online and talking about parosmia. This is my experience. This is what worked for me. The thing is that parosmia is different for every single person. Everyone has different experience. So I will give you so many tips and tools today so that you choose whatever fits you so that you can get the treatment that you need and you will respond to. All right. So another good news is that it will recover within few months in most of the people. So when we talk about parosmia, it usually resolves within few months. That means that most of the people will get parosmia. They will be very disturbed during those few months, and then within 2 to 3 months it will resolve and recover. However, with so many videos on parosmia, you guys did a wonderful job of commenting a lot on those videos, and it's kind of like a support group in the chat and comment section. Lots of people reported that their parosmia has been going on for a long time, like longer than 1 year. And today we'll talk about the treatment for that. All right, so let's give you practical tips that you can use and follow for you to first deal with your parosmia and live with it until you get better and recover. So the first thing, you need to consult with your doctor. It's good habit to talk to your doctor, because your doctor will be more updated. You discuss all of the things that will provide you with the safe treatments. And even if you read something online or even like watch this video, I want you to go back to your doctor and ask them, what is the treatment? I heard online this. Is this a good fit for me? Because sometimes people will do things online that does not necessarily fit you. So first, consult with your doctor. Second tip, very, very important. I want you to keep a parosmia journal. And so how it works. So I want you to have a journal that you will log in all the information and all the smells that you have, so that you can keep a track of how things are going and how you are smelling and how the smell is changing. And then what you do is that say like, okay, so I ate a hamburger, it tastes so awful, it is bad. You log it in and leave hamburger and don't eat it again. And then you keep logging in and experiment with multiple different foods until you find the good foods that fits you, and then you can eat them, and then maybe revisit that after a month or so that you can taste and smell that again and see if it's not good or if it's coming back. All right, tip number 2, I want you to identify the foods that makes you have a bad smell and taste, and then list them and avoid them. So start eating foods, experiment with different things. Some people are picky and just eat one single type of food. Now it's time to experiment, time to give your body a chance to experiment multiple things, so that you can find and identify the things that fits you best and then do them more. And then what you can do is that avoid spicy and high flavored food, because when you have a spicy food, that's a high trigger for the olfaction system. You're flooding the system with so much information that can be disturbing, and that can induce those parosmia symptoms that you want to avoid. So definitely avoid spicy food. I know this curry, it looks amazing. I really love it. But if you have parosmia, it's time to avoid it a little bit, so that you give your brain time to recover, and then you can you can get that back. All right, more good tips. And so one of the practical tips is that you have to, when you eat, you will experience this. So this is what I give my students when I was teaching them the difference between taste and smell. So when you taste is a very basic thing. That's like, is it sour? Is it salty? Very basic. But the smell, the flavor, is that what you get in your nose. When you eat something, it's hot or cold, but you need to, when you eat it, then you will feel the smell and flavor of that. And that will go through your nose and then nasal cavity. So you see, like, this goes through your nose, and then when it goes to the nose, it will get processed by the olfactory nerves right here directly, and then that will get processed in the brain. So if you disturb this circuit by closing your nose, and you can try that, so to kind of like close your nose and clip it so that the flavor will not go outside into your nose, and then feel the parosmia. And then so what I used to teach my students is that I give them a gummy bear, and then they will eat it with their nose closed. And then I will ask them, like, do you feel any flavor? And they will say no. And then I'll ask them to open their nose and then start breathing. Then the air will come inside and will take all the flavors of the food. And then they will identify, oh, this is mango gummy bears. So this is what you want to consider doing. Close your nose when you eat, and then make sure that the food is out of your system, and then you can breathe back in. Like, some people like some nose clips for the swimmers, and those tips can be very helpful. And then what you want to do is that you can eat cold food. So eating cold food is very helpful, because cold will decrease the aroma and the flavors out of the food. So for example, when we there is like a hack from the chef in the kitchen. They say that if you want to chop onions without getting tears, just put the onion in the fridge. That's what I do in my house. I put the onion in the fridge, and then when we chop it, it does not put those sulfur aromas that make you tear. Same thing for other foods. So eating colder food can help you to avoid getting that sense of smell and distortion. And then desensitization techniques. So desensitization techniques is that when you start smelling things, then that will go into the olfactory system, and then that will saturate the receptors. And then after some time, you will stop feeling it or sensing it. A great example of that is that when the airport, go to the perfume section or go to any perfume shop, you start smelling perfumes. You smell the first one, the second one, the third one, and then after that, you will stop smelling them, and then they will give you a coffee beans to smell to kind of reset your receptors. So sometimes you can challenge that bad smell and taste and eat, and then try to eat like 1, 2, 3, 4 times, and then if that sometimes it takes care of the smell and bad smell by flooding the system and desensitization. All right, so other things that you can do is that when you close your nose when you're eating, and then we will talk about the olfactory treatment. So we'll get to some comments, and then we'll answer all the comments section, and then I will have a time for you to answer all the comments. I see lots of comments coming in. Thank you all for participating, and I will definitely answer your questions. So the treatment of parosmia, the first thing is that you want to avoid triggers. This goes to the point before that I want you to identify all the foods and smells that triggers your parosmia and the bad smell, the rotten smell, all those like chemical things. Identify them and avoid them. When you avoid eating the foods that triggers you, then you have more appetite, and hopefully you can find foods that you can tolerate. However, sometimes it's difficult. And then the second thing of treatment is the olfactory training. Among all the evidence, the olfactory training is one of the most important and the most effective treatments for sensory and nasal disorders, as I mentioned in multiple videos before. So I will link that in the cards below, probably like it's coming in here. So I'll put that in the cards, the videos I talked about olfactory training using a home recipe and olfactory training using essential oils. So what you want to do, you can do olfactory training using home recipes, things that are in every single house. You don't have to buy anything and use that. So here's how we do olfactory training. So I want you to first identify 4 scents, and those scents can be like things around your house. I got like a lemon, and then maybe like basil leaves, oregano, something that has like a good flavor, and a good cardamom. I love it with food. So what you want to do is that you want to take the smell, the scent, and then just a little bit of sniffs, slowly smell it and let the brain feel it. And sometimes you will not feel anything or you will not sense anything, but I want you to keep doing that. So smell it for 25 seconds, and then you will imagine how that used to smell, how the lemon used to smell, how the onion used to smell, everything. Just give it 1 minute. So 25 seconds of smelling, 1 minute for rest, and then that will give the brain time to process. And then you finish the first one, go to the second one, open the jar, and then just give it a little few smells slowly, and make sure to kind of imagine how that used to smell like before. And then 25 seconds, wait for 1 minute, and then go to the third one, go to the fourth one. Identify 4 smells and smell that every single day for at least 3 months, and you can go to the next 3 months and the next 3 months. It takes time to get those smells back, and until the nerves regenerate and grow back, that takes a long time. So you want to be patient and identify and do those olfactory training. And then the second thing for olfactory training, you can use essential oils. Essential oils are one of the most important things you can do. So we identify 4 essential oils for every treatment session. So we recommend, like, you can get like essential oil kit. Like I got this kit just for just for illustration purposes. I put some kits in the description below. I do not endorse any products or anything. It's just any essential oil. You can go to your herbal store and pick up any oils that you want or use. For example, this is like eucalyptus, lemon, clove, and rose. So what you want to do is that the same thing. You take the smell it for 25 seconds. Slowly, do not like over breathe it. You just want to get it into your nose, and then rest the brain for 1 minute, and then go to the next scent, and then smell it for 25 seconds, and then go to the next one, and so on until you finish all 4 of them. And then you do that morning and night without cheating or being non-compliant. Every day you have to do it so that you get your smell back. And then the other thing is that when you do that, you keep doing it for 3 months, then you will change to different set of essential oils for 3 months, and then the third one. All right. Medication. So medical treatment. There are no approved treatments so far for parosmia. The nerves are affected. That means like the covering of the nerve in the brain is affected. So it takes time for the brain to rebuild those connections and connect them back. So what you need to do, you need to support the brain so that it can recover and put them back. So there is no medication that directly can treat the parosmia. However, there are some medications that we use usually for other conditions like epilepsy or for neuropathy when the nerves are affected in the hand because of something like diabetes that can affect the nerves. So you can use neuropathy medications. Well, I will not give you the names of the medications just because, like, to be honest, those medications need to be given by a specialist and a doctor, hopefully neurologist. And you discuss with your neurologist if this medicine is the right for you, because I don't want to like give you a name of medication and then you go to the pharmacy. Okay, Dr. Danoun said that this medication works for me, and then you take it and because medication needs monitoring, needs prescription, needs some maintenance. So I don't want you to just take medications on your own, but discuss with your doctor. There are some medication that works for neuropathy that can be given to decrease the short circuits and decrease the wrong transmission in the nerves of the brain. Okay, so this is what the treatments of that. So we get some questions. So Jair asked, can I get vaccinated even if I have parosmia? Well, Jair, thank you so much for the question. Yes, you can get vaccinated. Actually, there are studies that were done on people who had post-COVID-19 long hauler symptoms, and it found that most of the people experience improvement in their long hauler symptoms after doing this. One of the most important things that you can do is that you can need to provide a healing environment for your brain to recover. If you have chronic conditions like diabetes, hypertension, high cholesterol, you need to get them all under control so that the brain will recover. Keeping a healthy lifestyle, sleeping like 8 hours a day, avoid stress, and definitely you want to get enough exercise, because exercise will reset the circulation. It will help you to kind of recover much better. All right, so now we will get to some questions. All right, so please put your questions in the chat so that we can get back to you. All right, so Kushi Dude said, how much time it will take? So thank you so much, Kushi, for asking this question. It takes long time sometimes. Most of the time it will take a few weeks. However, it can take up to months for people to recover. So you want to be patient with yourself. Give your brain and self time to recover, and it will get better with time. So I want you to keep the journal and until you get like improvement. All right. So other things. So comments for this. So please, when you have a question, put in the question mark before that, so I know that this is a question. And then Amzi, can vitamin B12 be for better nerve function to treat parosmia? Well, thank you, Amzi, for the question. So we know that supplements can help, like zinc and vitamin B12, although and multivitamins, it can help, but we know that this is not the ultimate treatment, and sometimes taking too much zinc can be harmful to you. But definitely vitamin B12 is a safe vitamin, and it has been shown to be helpful for the nerves, so you can try that for the nerve health. Of course, give it a try and let us know how are you feeling. All right. So Samiksha, sorry if I say the name wrong, said strange smell while cooking, especially onion. That's right. So as you see that everyone has different smell and taste, and they will definitely feel how everyone is feeling that. So that's what you want to do. All right. So Hanan Yassin said that why doctors do not do anything to treat us. Thank you very much. Well, so here's the thing, Anas. I totally feel your pain, and this is what I'm trying to do. We have now a center in the United States. We have a center for COVID-19 recovery. So what we are doing is that we collected multiple doctors from multiple different specialties, and I am running the neurology aspect of that. What we are trying to do is to do research and find the treatment and the cures for this very disturbing aspect of life. And hopefully we will conduct clinical trials, means like trying medications for people so that they can get their smell and taste and parosmia better. So we are learning this on the job, and we are researching it and trying to study it better. So definitely we'll keep you updated, and hopefully we can get you cured, and then be happier afterwards. All right, so what we will do is that we have a whole playlist about long hauler symptoms and things that you can do about the long COVID-19 symptoms. I will put this here. Make sure to watch all those playlists, and then see you in the next video.